L5-S1, nerve root entrapment, L5-S1 disc herniation, bulge. Any issues around this region? What exactly is it? What does it mean? Just a polite reminder: vertebral column, posterior aspect, anterior aspect. So this is the back, this is the front. What you were seeing is the side-on lateral view. Let's turn the patient with their back to you. We've got the 5 lumbar vertebrae. The bottommost is referred to as the L5. The first sacral segment is what we refer to as the S1. Why do we then refer to the nerves or the discs as L5-S1? Well, that's because the disc is located, let's turn over to the front, between the lumbar 5 and the sacral 1, or the first sacral segment and the 5th lumbar. It's between those two vertebrae, hence L5-S1 disc. In equal fashion, we have the nerve that exits that level. We have demonstrated over here this yellow extension that is extending, or it is exiting through the aperture that is formed between the 5th lumbar vertebra and the first sacral vertebra, or the segment. Hence we refer to it as the L5-S1 nerve root, the root emanating directly out from the spinal column itself. The aperture that is what we call the intervertebral foramen. That's because it's formed between the vertebrae. It's usually the vertebra above and that below, and the aperture can become compromised. The size of this becomes compromised in a number of reasons, or a number of causes. Most commonly with this situation at the L5-S1, it generally is degeneration, dehydration, or a disc herniation, amongst other causes. A number of patients have come across or have been offered facet joint injections. Facet joints are the joints formed between the two vertebrae, the one above and the one below. Facet joints dictate and enable motion throughout the spine, and the angulation of the facet joint varies between the cervical, the thoracic, and the lumbar. Different planes to support and dictate different ranges of motion in different planes. Okay. In the context of L5-S1 issues, what happens is, let's say for example a disc herniation. That herniation, that disc bulge, will protrude. The herniation will usually be in a posterior lateral direction, so kind of 45 degrees angle. And what that then does is it compromises the space, the lumbar, the IVF, the intervertebral foramen. That aperture becomes compromised. It then irritates the nerve as it exits over here, and that will then manifest itself as pain from the lower back, perhaps through the buttock, may well skip the thigh, and then manifest itself in the calf, like a cramp-like sensation, and in some cases it will go on to give you symptoms of a band-like sensation around the ankle, a tension band-like sensation. I have done other videos on the lumbar spine anatomy, the basics, the cervical, thoracic and lumbar, how it is we denote the letters and numbers, and there are other videos on a bit more detailed anatomy of the actual vertebrae and the discs, how discs protrude, in what direction, and so on and so forth. You can watch those and then build this on this video on those. One of the ways in which we clinically determine or diagnose an L5-S1 nerve root issue, perhaps due to a disc lesion, a disc herniation, is by asking a particular set of questions, including one of the most important ones: do you feel the cramp-like sensation in the calf or the tension band-like sensation around the ankle when you cough, sneeze, or bear down. Collectively, these are known as the Valsalva maneuver. What we're doing in the given situation of coughing, sneezing, or bearing down on the toilets is that we are increasing the intra-abdominal pressure, the pressure within the abdominal cavity. Sometimes what's overlooked is that we do not consider a disc herniation in the same way as we might consider a hernia in the abdominal wall, inguinal hernia, umbilical hernia, and so on and so forth. Well, this is no different, except the weakening is in the wall of the disc itself, and the protrusion is that of the contents, the nucleus pulposus, the liquid content of the disc itself. So a herniation on the disc is exactly a hernia, except it's not in the abdominal wall, and it's more so confined to the disc itself. When we increase the intra-abdominal pressure, what we are doing is if on those occasions the patient manifests those symptoms, that's a positive. And what's happening is you are actually increasing the pressure through the weakened annulus fibrosus, the outer layer of the disc. The pressure is sufficient to force the nucleus pulposus, the liquid center, through that weakening of the wall and replicating that bulge for its occurrence. That is kind of a simplified version, but that's precisely what's happening, hence the positive result on the Valsalva. And there you have it, L5S1 disc, L5S1 nerve root irritation or impingement. Intermittent refers to it that the irritation to the nerve is on and off. Sometimes it happens and other times it doesn't. There are occasions where I have seen both intermittent nerve root impingement, nerve root irritation, and nerve root in its entirety impingement that's constant, that perhaps even in some cases warrants surgical intervention in the event that manual therapy was insufficient. I hope you enjoyed and I hope you learned a couple of things, and that, my friends, is that. Thank you for watching.